We spoke a little while ago about models of lesbian and gay identity development, and now we're going to talk some about bisexual identity development models. The first is the model that was developed by Weinberg, Williams, and Pryor in their study that was done in San Francisco in the 1980s, and in their book Dual Attractions, which was published in 1994. In their model, there are 4 stages to bisexual identity development. The first is initial confusion. The second is finding and applying the label. The third is settling into the identity. And the fourth is continued uncertainty. Let's also look at another model of bisexual identity development. This one is created by Mary Bradford and was published in 2004. In her model, she takes a little bit different perspective. The first step is questioning one's own reality, followed by inventing one's own identity, and then maintaining that identity, and finally by transforming adversity. What's significant about Mary Bradford's model of bisexual identity development is what she says in her 4th step, transforming adversity. In this step, she sees bisexual people facing the stereotypes and prejudice that other people have as an important step in being able to develop a positive bisexual identity. So now let's talk about counseling and psychotherapy issues for bisexual people. There are individual, couple, and family issues, and these are similar to the sexual orientation-related issues and the gender identity-related issues of lesbian, gay, and transgender clients regarding attitudes and prejudices towards lesbian, gay, bisexual, and transgender people. There are also differences with bisexual women and bisexual men in terms of their resilience, their ability to cope with the effects of invisibility and negative attitudes and prejudice. In addition, there are some differences regarding presenting issues ranging from no focus on bisexuality to a definite focus. And of course, there are coming out issues that bisexual women and men might bring to therapy as well. These include questioning, exploring their attractions and their identity, facing external and internalized attitudes, adopting and maintaining identity, and finding support in similar others. And you can see that these relate to the stages of bisexual identity development that we discussed before. In addition, there are the minority stress mental health effects that we've been talking about before as well. There's a possibility of anxiety, depression, substance use, and HIV risk factors. For some bisexual women and men, these may not at all be issues that they bring to therapy because they may be more resilient and be wanting to focus on other aspects of their experiences as bisexual people in therapy. Let's talk for a moment about bisexual people in relationships. Naturally, there's a range of the kinds of relationships that bisexual people may be in. They may be single, they may be in a couple, they may have a family of their own. They may be in a same-sex relationship or an other-sex relationship. They may be monogamous. They may be in an open or a poly relationship. And of course, they may have families and maybe parents as well. So you can see there's a lot of diversity in terms of relationships that bisexuals may be in. And this means that the kinds of issues that they may bring to therapy about these relationships will vary. Now let's summarize the counseling and psychotherapy issues that bisexual women and men might bring to you as a therapist. There are relationship-related therapy issues that we just talked about. There's identity development and maintenance issues that we also talked about. For many people, disclosure is an issue, whether it's at the beginning of a relationship or whether it's in a pre-existing relationship. Same-sex and other-sex relationships is, of course, a topic that people can bring to therapy, as well as monogamy and non-monogamy issues. For many bisexuals, there are issues around support with partners, with friends, and with family of origin. And of course, there are parenting and family issues that can come up too. Let's conclude now with a few words about culturally competent practice with bisexual people. First of all, consider sexual orientation as multidimensional rather than dichotomous. Acknowledge bisexuality as a valid sexual orientation. See bisexuality as normal versus pathological or a transitional state. And then be aware of bisexual health issues, both from an individual and contextual point of view. Understand the health impacts of minority stress on bisexual people. And take a bisexual affirmative therapeutic approach as opposed to reinforcing societal attitudes and stereotypes. And finally, consider further education and training in LGBT affirmative approaches, including those in working with bisexuals. So I'd just like to say thank you very much for your interest in developing greater awareness about bisexual issues in counseling and psychotherapy.